everyone. My name is Xiaoxi. I am the Endowed Scientific Director of Pragmatic Trials and Evaluation at Mayo Clinic and also an Associate Editor for JACC. And today we are honored to have Dr. Khurshid and Dr. Ajufo here with us. Dr. Khurshid, can you introduce yourself?
Yes, thank you for having me. My name is Shaan Khurshid. I am a cardiac electrophysiologist at Massachusetts General Hospital, instructor of medicine at Harvard Medical School, and an affiliated scientist at the Broad Institute of MIT and Harvard.
Thank you, Dr. Khurshid. Dr. Ajufo, can you introduce yourself?
I'm also incredibly honored to be here. My name is Ezimamaka Ajufo. I'm a fourth-year general cardiology fellow at Brigham and Women's Hospital. I am also an affiliated scientist at the Broad Institute, and I look forward to having this conversation.
Thank you. So can you give an overview of this study?
Absolutely. So current cardiovascular prevention guidelines highlight the importance of achieving at least 150 minutes of moderate to vigorous physical activity per week. And, although sitting is generally considered harmful, the evidence is relatively lacking and guidelines fail to provide specific guidance. So the study question was really, what is the association between accelerometer-measured sedentary behavior and the risk of specific CV outcomes, including how these risks relate to time spent engaging in MBPA, so that's moderate to vigorous physical activity. We use data from a sub-cohort of individuals from the prospective UK biobank cohort study with a week of movement data from a wrist-worn accelerometer. Sedentary time is defined using a validated machine learning algorithm, and then we assess the associations between sedentary time and future incidence of 4 major CV outcomes. So that's atrial fibrillation, myocardial infarction, heart failure, and cardiovascular death. So the results, baseline characteristics, we have about 90,000 people, predominantly middle-aged, about 56% of them were women. And the median sedentary time in this group was about 9.4 hours a day. And we really had 2 key findings. The first was that greater sedentary time was associated with a higher risk of AF, heart failure, MI, and CV mortality, but the effect of a sedentary lifestyle varied by outcome. So with heart failure and CV mortality, the associations of the effect was large, with evidence of an inflection point at 10.6 hours per day, where the risk was sort of about 40 to 60% higher than the second quartile, which is about 9.3, 8.6 to 9-ish hours per day. The associations with AF and MI were smaller and more linear. And we also found that the greater risks of heart failure and CV mortality with sedentary time above 10.6 hours per day persisted, even amongst individuals that were meeting guideline adherent levels of MBPA. So that was pretty interesting.
Yeah, it's indeed very interesting. So there has been extensive literature in this field. So what do you think are the key highlights of this study that's distinguish this study from prior study, either in the methods and in the key finding? I think you touched some in your overview, but just give people a 1 or 2 sentence highlight.
Yeah, happy to do that. I think our study really expands upon the prior literature in, I would say, 2 key ways. So one is that the predominant method of assessing sedentary behavior in the past has been self-reported behavior. And we know from prior studies that that is relatively inaccurate. So people tend to underestimate their own sedentary behavior by up to 40 to 60%. And so our ability to assess and measure sedentary behavior using wrist-worn activity trackers and a validated machine learning approach to quantify sedentary behavior is one key advance. I would say the second is that we were able to leverage this comparably large data set of nearly 90,000 people that had measured sedentary behavior, which allowed us to key in on specific cardiovascular outcomes that are important, namely heart failure, MI, cardiovascular mortality, and atrial fibrillation, rather than broad outcomes like overall mortality. And that allowed us to kind of see these unique patterns and how the associations differ by outcome and the relations with MBPA differ by outcome, as summarized nicely by Dr. Ajufo.
Thank you. So what's the key takeaway message if you want to tell like one sentence to your patients or clinicians? So what are the key one message you want them to remember?
So we really want to drive home the following. Avoidance of excess sedentary behavior is important or appears important to reduce cardiovascular risk, whether or not individuals already achieve guideline adherent levels of moderate to vigorous physical activity. And then just to tack on, ensuring sedentary time is less than 10.6 hours per day, maybe a reasonable minimum target for public health interventions aiming to optimize sedentary behavior for cardiovascular risk. Those would be the sort of two high-level takeaways we'd like to leave with those reviewing the study.
Yeah, that's great. So this is truly very important, innovative, and interesting study. So I'm curious, what's the next step, either from your research or in the field? What do you see is the next step of the research?
Thank you for the question. I think I would highlight three things. I think one, we know that physical activity and potentially sedentary behavior is important not only for cardiovascular risk, but potentially diseases across the full spectrum of human conditions. And so we think it's important to expand this out and see whether the associations, how they differ across not just cardiovascular disease, but all disease. Second, we did measure sedentary behavior over the course of 1 week. That's conventional in accelerometer-based studies, and it's been shown to be relatively stable over time and reflect habitual activity. But that's still a relatively short period of time. And so as the availability of data sets that have longitudinal behavior over potentially even years are becoming increasingly available, we think it'd be important to quantify whether patterns may change when you measure sedentary behavior longitudinally over longer periods of time. And then the last thing is I think studies like ours compel prospective interventions and potentially trials where we test physical activity interventions focused on minimizing sedentary time, even among people who already exercise.
Yeah, that's really exciting. I hope you guys can submit future research to JACC. And thank you both for taking the time to do the interview with us. And I encourage everyone to check out this paper online. So, and thanks everyone for listening and watching.